So we're gonna come in, wash our hands, tell them who we are. Hey, I'm Lee. I'm gonna be your nurse today. Can you tell me your name, your birthday? Show their bracelet. They'll tell you. All right, I'm gonna be doing a head-to-toe assessment on you today, and I'm gonna start with doing your vital signs. First, do your blood pressure. So I'm not actually gonna check it, but we would check it because I don't have the monitor on. Check the blood pressure. Okay. Feel for the pulse. We're gonna count the pulse for a complete minute. Once the minute is up, then I'm gonna continue holding my hand there, and I'm gonna assess for the respirations. Remember, their chest will not rise, so you're listening for that, okay? And you're assessing that for a complete minute as well. All right, once that's done, then you can ask them about their pain. Ask them if they're having any pain anywhere. Everybody will have pain somewhere. Then you're gonna go into your P, Q, R, S, and T, okay? Make sure you ask them all those questions, okay? How's the pain on it? Where's the pain at? They say in their stomach, be specific. Where exactly in your abdomen? Use this time to re-educate them because stomach is an internal organ. So where in your abdomen is actually hurting? Can you show me, okay? And then on a scale of 0 to 10, how would you rate it? 10 being the worst, okay? And then, is this pain constant or does it come and go? What makes it better? What makes it worse? How long has this been going on for, okay? And then, is it dull? Is it sharp? Is it throbbing? Tell me about this pain, okay? What's brought this pain on? And then, once we've done that, we're gonna go on and ask them about, can you tell me, we're gonna assess their orientation, okay? We need to assess their alert and oriented times 4. So can you tell me, can you tell me where you're at? So we're assessing for person, place, time, and situation. So on time, I would not ask specifically what time is it. Nobody in the hospital is ever gonna know what time it is, okay? They may not know what day it is. I would ask, can you tell me what month it is? Or even what year it is? Can you tell me who the president is? Can you tell me what's brought you in today? Okay, and can you tell me your name? Okay, which you've already asked them their name earlier when you asked their bracelet, okay? Now just tell them that you're gonna go ahead and perform their head to toe assessment, okay? I'm gonna go ahead and feel of your head, okay? I'm gonna assess for any lumps or bumps in your head, okay? Great. I'm gonna assess behind the ears. You can come to both sides of the bed to assess behind the ears. Take your pen light and look in this ear, come to the other side of the bed and look in this ear, okay? Take your pen light, tell them to look straight at an object, follow the pen light with just their eyes, don't move their head, okay? Great. Good, okay? Just follow it in. Great, all right, now I'm gonna assess your eyes. Great. Do you have any changes in your senses? Any changes in your hearing, your vision, sense of taste or smell? Checking their nose. They have none. Okay, great. Can you blow out your cheeks for me? Close your eyes real tight. Stick out your tongue. Raise your eyebrows up. Great. Smile real big for me. Show me your teeth. Great. Stick out your tongue. Let me look in your mouth really good. Great, checking the mucous membranes, make sure they're nice and pink and moist, okay? Now at this point, I'm gonna ask them to open and close so I can check for any TMJ. Then I'll come on down and assess their neck. Feeling for any lymph nodes enlargement, so I feel none. Then I'll assess the trachea, make sure it's nice and midline. Palpate the thyroid, don't feel any thyroid nodules, okay? At this point, I'm going to go ahead and listen for carotid bruise with the bell. Okay, that's going to turn away from you. Take a deep breath in and hold it. Okay, great. Now breathe. You'll turn the other way. Take a deep breath in and hold it. Okay, breathe. Good. We'll assess for a pulse, one at a time. Assess the other side. Okay, great. All right, we're gonna come on down. We're gonna assess skin turgor. So your skin turgor is good. I'm gonna ask you to go ahead and tuck your chin down and up. Move your head left and right. Okay, great. Can you shrug your shoulders for me? Perfect. All right. We'll go ahead and listen to your heart real quick. Just breathe normal for me. We'll listen with the diaphragm. In 5 locations. Okay. And come back and listen with the bell in the 5 locations. Okay. All right. I'm going to look for any heaves. I'm going to feel for any thrills. Okay. Now I'm going to go ahead and listen to the apical pulse for a complete minute. Okay. Once the complete minute is up, I'm looking for symmetrical chest rise, noting if there's any scarring on the chest. Then seeing if they have any work of breathing. I'm going to go ahead and listen to their lungs. We'll listen anteriorly first. Have them take a deep breath in and out. Again, in and out. Again, in and out. Again, in and out. Okay. I'm going to listen under here. In and out. In and out. I'm going to listen laterally. Deep breath in and out. Another deep breath in and out. Okay, great. Now I'm going to go ahead. Can you help me raise her up? I'm going to go ahead and raise you up. Okay. I'm going to assess for any cervical tenderness. Feel to see if there's any. Is it tender right here? Going down to C7. Shows no tenderness. And then I'm going to listen in 6 locations. Deep breath in and out. 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 Great job. All right, now I'm going to check for tenderness down here. Just let me know if you have any pain. Any pain there? No? All right, what about here? No? Okay, great. We'll lay you on back. Good job. All right, now I'm going to come on down. I'm going to look at your belly. I'm going to look first. So we're inspecting, looking for any scars, checking to see if it's nice and round, if it's flat. Now I'm going to listen. I'm going to listen in all 4 quadrants for bowel sounds. First, I'm going to ask, before I begin this, I'm going to ask, do you have any belly pain? If they have any abdominal pain, then I'm going to start in that location last, okay? And they have no belly abdominal pain, so I'm going to go ahead and listen. Okay, great. All right, now I'm going to lightly palpate. Good. Now I'm going to firmly palpate for any masses. There's no masses noted. Good deal. Bowel sounds are nice and normal, active times 4. Okay. When was your last bowel movement? Okay. And can you tell me about the color and the consistency of it? Are you having any problems with urination? Any frequent urination, burning on urination, anything like that? No? Okay, good. I'm going to check to see the skin color and the temperature and the moisture of it. I'm going to assess for capillary refill here. I'm going to go ahead and assess for radial pulses to make sure that they're nice and equal. I'm going to go ahead and assess for range of motion. I'm going to range your arms up. Great. Move this one. Oh. Good. Great. All right, shrug those shoulders up for me. Back down. Good. All right, now I'm going to come on down. I'm going to check your femoral pulses, okay? Now down, I'm assessing the legs, making sure I'm keeping her covered. I'm assessing for any swelling in either of the legs. Getting on down to the legs. I'm gonna take your socks off. Okay, all right. I'm gonna assess both your feet, check your pulses. Okay, good. I'm gonna check capillary refill. We'll check the range of motion in your leg. Good. Check your foot. Here. Good. Over there. All right. And then as I'm wrapping up, I could then take and look at my sheet. What do I do with my sheet? And see, hold on, I was gonna see where my sheets are. Hold on. I would then take, at this point, I would look at my sheet and say, oh, crap, forgot to look at, to check for the strength in their hands. Oh, okay, I'm gonna go back up. Squeeze my hands for me real tight. Okay, great. Then we'll look. Yep, that. Oh, man, I knew I forgot something. We'll check for JVD. So I'm gonna look, no signs of JVD there. No signs of JVD. Okay, great. Yep, did all that. TRTs is good. That. Okay, I think I'm done. At this point, I will make sure I put my bed in the lowest position, give them their call bell back, put their sock back on, and cover them back up and see if there's anything else I could do for them. And I'm done.